Hello, and welcome to the channel once again. This is Nesben here, your buddy friend for anything NCLEX-RN exams. So today in this video, we would be looking at what the NCLEX-RN exam is. So someone may ask, what is the NCLEX? So the NCLEX is basically an abbreviation for the National Council Licensure Examination for Registered Nurses. So basically it's a nationally recognized examination that is organized for anyone who aspires to become a registered nurse. Usually you would have finished training in nursing school in order to be able or eligible to write this very exam. Now, someone may ask, what is the purpose of the NCLEX-RN exam? So basically, it is for you to receive a license, and this license allows you to practice nursing. But we should take note that this is state specific, and so you will find out that every state have a different set of rules for whoever wants to take the exams. However, the exams is usually the same. So regardless of the state you've registered for, you should be able to still take the NCLEX-RN exams. Let's move on to the structure of the exams. And this is very important because when you want to embark on a journey, you want to know what it entails. And so the very first thing I want to talk about is the fact that it is a computer-based test. And usually it is taken at a Pearson VUE center. And these centers at the moment are very scarce around the world. However, there are plans to enroll more centers. So I know that you can get these done in South Africa, the Philippines, India, and the United Kingdom. But there are many more centers in the United States. So if you want to take it in the United States, that's also something you can do. But it's usually very little amount of centers outside of the United States. The questions are multiple choice questions, so you have to select an answer from a multiple choice of answers given you to a particular scenario or to a particular question. Sometimes you will need to identify a sequence. So for instance, in what sequence will you put in a urinary catheter? And so you get a step 1, step 2, step 3, and you need to arrange the sequence. And also you may be given a picture for you to identify. And so based on the picture, you determine what could probably be wrong with the patient or with the person. To mention that the NCLEX-RN exams changed not long ago in April, where we got what we call the next generation NCLEX. And just that the format of the exams is literally the same, but more question types have been added on to this exam. So you realize that you find things like now case studies, where you, based on a case study, you are asked questions and you identify the problems in the question. Also, I need to mention that the questions are not repeated. And so no two persons who have the same set of exams. It is worth noting that you may see things that are similar to what you may have studied at some point, but no two NCLEX-RN exam questions are the same. And so don't fall for people who say, you know what, I got this type of questions, and so you are likely also going to get this type of questions. Because it's a computer-based adaptive test, it gives questions based on your ability to answer the questions being given on the day. Now, what content does the NCLEX-RN exams cover? So basically, there are nine different concepts or aspects of nursing that is being examined on these exams. And I'll just briefly mention them, and probably we may do a video later on going in depth into what every aspect entails. But the very first one is management of care. You've got safety and infection control. You've got health promotion and maintenance. You've got psychosocial integrity. You've got basic care and comfort, pharmacological and parenteral therapies, reduction of risk potential, and psychosocial adaptation. These are the main 8 areas that the NCLEX-RN will cover. So whichever uh, test you see, you are likely going to see bits of all this being represented on the exams day. Now, in terms of allocations, so there is a certain percentage of questions you are likely going to get from these areas on the test. So if we look at management of care, you're likely going to get 15 to 21% of the questions you may be asked on the NCLEX will be around management of care. For safety and infection control, you've got 10 to 16%. Health promotion and maintenance, you've got 6 to 12%. For psychosocial integrity as well, you've got 6 to 12%. And then for psychosocial integrity, you've got the main divisions under there, which is basic care and comfort, which entails 6 to 12%. You've got the pharmacological and parenteral therapies, which is 13 to 19%. So that's actually a big chunk of the questions that you get on there as well. You've got the risk reduction potential, and that's 9 to 15%. And then you've got psychosocial adaptation, which is 11 to 17%. So on your screens now, you see the various allocations in terms of percentages of questions that you may get based on these client need areas. So let's talk about the exam itself. Now, we know that it is computer adapted testing, which most people call CAT. Now, for the exam, usually you have a 5-hour period to take the exams. I need to say that breaks are inclusive of the 5-hour time that is given for the test. So once you start the test, regardless of how long you take in breaks, which I would encourage you to take anyways, this is counted as part of the exam score. Now let's look at the length of questions one can possibly get on the NCLEX-RN exams. So you've got a minimum of 85 questions and a maximum of 150 questions. What this seeks to imply is that an individual can pass or fail the NCLEX at 85 questions, and an individual can also pass or fail the NCLEX at 150 questions. Now, in terms of the number of questions you get, that is based on your ability on that day to answer the questions well. So I've got friends who have written the NCLEX and have passed at 85 and out. And personally, I am not of that group. And so I did my NCLEX in 146 questions, and I'll tell you the story behind that. But yes, you can actually pass the exams, and you can pass it at 150. So there's no rush on the day to try and get to 85 and be out. If you get 85 and out, that's great. But if not, just keep pushing and it's still doable. So I mentioned 8 client need areas that the NCLEX-RN exam usually tests. And questions would come on that day from every single bit of this client need area. So there's no running away from. And so one must be abreast with all the information, or at least with most of the information that the person needs to know for the test. Let's talk about passing or failing the NCLEX. Now, the NCLEX would only give you 2 outcomes. You either pass or you fail. Now, I want to encourage you that yes, people do pass the NCLEX. So if you are thinking of taking the NCLEX, do not be worried about not passing. All you need to do is to prepare adequately, and you would be able to pass. And so we've got a 95 confidence interval rule, and this is just when the computer gets 95% confidence in your answer that you are above the passing rate. And so when that happens, the computer stops the test. Also, when the computer doesn't get a 95 interval, it gives you more questions up until you get to 90. You get onto 150. Now, that leads me to the point number 2, which is the maximum length exam. So when you take the maximum length exam, usually your last questions that are answered, if you are above the passing rate, then you get a pass. If you are below the passing rate, then you get a fail. And then the third one, in a pass or fail, will be when you run out of time. But usually that is not an issue for most people who have taken the NCLEX. So once you run out of time, then the NCLEX exams stops there and it doesn't allow you to continue. So that's the little you need to know about the NCLEX as of now. For internationally trained nurses, you would know that you don't just register for the NCLEX. You need to go through a process of credential verification, and then following that, you can now register with the state board of nursing. I'm going to make a video on that just to throw more light into the things you need to do if you want to register for the NCLEX. But if you find this video helpful, you want to give it a thumbs up, you want to like, you want to subscribe, and you want to share with your colleagues, because on this channel we bring you anything and everything nursing, and NCLEX is the focus.